Thank you so much. And Sharmi, thank you for setting the tone actually of this meeting. And I think this is a good time where, um, we have been able to reflect where we started our journey back in 2009. And then very strategic, input starting with, 2016 from Chemonics. And in these 4 years, I think we have been able to gain many sufficiencies, as you rightly said, in terms of health system strengthening perspective. What does it mean to sustainability? What does it mean to domestic financing and systems actually? So I'll start with the agenda that Dennis actually kindly shared with Barry and Raf and my team members, Wayne, at the headquarters level. So these are the points that I will be discussing in my presentation. So I'll try to finish my presentation in 25 minutes, and so that we should have enough time for question and answer. With me are my team members, Ambreen Khan, who actually was inducted with us as an intern. Now she's the Director for Basic Health Services. We also have with us Director Vaccine Preventable Infectious Diseases and Private Sector Engagement, Nabil, who has been working with us also for 7-8 years. And I think probably my very esteemed colleagues at headquarters level. So without further ado, I'll start with this, a snapshot where USAID legacy, I would say, is not only owned by government of Pakistan from the perspective that how it has been injected into the system from a very pilot, of 19 districts, but now this is owned as an inter-donor kind of synergy and collaboration as well. So this has been, interventions that have been done by the CID have been actually, adapted as maybe, this possible linked indicator when we talk about, journey of, journey of, contraceptive logistics management information system to vaccines and MNCH products. And then, of course, Gates Foundation and the government of Pakistan was able to institute this system throughout the country. Now, from our perspective, I see that our journey has been at the core, of sustainability in terms of how we are walking, talking, and shouldering with the government of Pakistan. But fundamental elements of supply chain system strengthening, where forecasting and supply planning, procurement and commodity financing, helping government, not only understand these new concept and realization of supply chain into the health systems, but also building their capacity in terms of how to forecast, how to make sure that they make a journey from a conventional domestic demographic forecasting to logistics and market-based principles actually. And then, of course, monitoring, evaluation, and learning, warehousing and distribution, and human resource capacity. And all of this has been actually, supported with the technology that I would say government of United States has really generous in terms of building capacity, in the last 4 years in Pakistan. So I think first question was as to what shift we see. So I see from a strategic input when we started, in August or July 2016 as global health supply chain, I'm looking at, all fundamental elements of public policy from a supply chain perspective, as you see in this wheel, commodity security at the center of affairs. There has been quite a, in these 4 years, we see that, building capacity and owning these systems and, multiple donors opting this, and government of Pakistan building its capacity at various levels. This policy, this whole thing has been shifted from a supply chain system strengthening perspective to more of very strategic, kind of, journey where we see that, we have ensured sustainable public financing. I'll talk about that in a little while. Contraceptive pool procurement. This is the first time that, the regional governments of Pakistan have been actually able to demonstrate, a pool procurement mechanism that was assisted under USAID work. And then I think most importantly, as to graduating, a business of about $4.5 million of, contraceptive procurement or purchase of, commodities back in 2009, going to almost $25 million in public sector per year. So this tone has been changed, from that perspective, and it's a good news not only for local industry, but also the international industry that actually produces all these products, and we have been procuring this, about, $17 million was something that we procured in 2019. And then our representation, we have a space on the table, USAID, and Chemonics, and, we are part of the federal task force, which is presided and chaired by the President of Pakistan, President Alvi. Then the provincial task force of family planning and population, and those are chaired by the respective chief ministers of the provinces. We are part of that country engagement working group that actually looks at the commodity security, and then commodity security working group, a subgroup of the country engagement working group where USAID is part and parcel of the dialogues, with our, technical hat. We are part of all these, very distinguished platforms, actually. So this journey has changed from, we feel strongly that, some of the fundamental issues of strategic, investments from USAID on fundamental technical areas have shifted towards more of a policy and leadership, domestic financing, and inter-donor kind of sustainable partnerships. And one more shift was there, where USAID was looking at country development cooperation strategy, where we were working as Afghanistan-Pakistan bordering areas, and in just 1 year time, we have been able to introduce a concept of basic health services that actually, underpins the importance of not only task order 3, but also task order 4. So this, has been a shift in terms of how we are positioning ourselves for Afghanistan-Pakistan bordering areas. And I'll talk about this, that this is a package that we actually delivered today to the Department of Health KP, Afghanistan-Pakistan bordering areas in Khyber Pakhtunkhwa province, which is about 15% population-wise, in the country. And we have actually graduated Pakistan from, established interventions at Central Warehouse to, provincial and district. And now this has gone to 6, packages on quantification, forecasting, warehousing, MIS, distribution, commodity security sciences for the district governments, actually. So this is a unique development that we have been doing in partnership with KP government. And I was very happy to hear from the government of Khyber Pakhtunkhwa saying that we would like to scale it up in all 35 districts of the province. And this is a development, I would say, Shami, when you're saying that how this leveraging of technology and documentation and technical capacity, where we are graduating governments at national level, provincial level, has gone into the weeds at the district level and below, where we are now finding out good changes as to how the system is actually influencing a Pakistani system of about 16,000 health establishments in the form of basic health units and RSC, THQ, DHQ. This is all primary and secondary healthcare infrastructure operating at the district and sub-district levels. Again, I have touched about it, and I'm very happy to share this slide with you. This is a work that comes from Rami and Kevin Pills and Sharmi, and our colleague Khalid and colleagues at USAID Pakistan. In this, this was a work that we were able to see and see that where Pakistan, stands in terms of its position with India, Bangladesh, Sri Lanka, and other countries. And we find Afghanistan, and we found that in the regional countries we are the second highest, only after India. India is spending about 97% of domestic financing, domestically procured from taxpayers of Indians, and likewise we're about 96% actually. So 96% means that this $132 million, $130 million is coming from taxpayers of Pakistan, and this is a great development. I think it's a great news not only from the perspective that how USAID investments in technology on supply chain has actually brought visibility to the radars of national, provincial, and district levels, but actually translated into procurement of about 17 or $25 million in the public sector per annum actually. And likewise in the private sector is about $25 million. But I think commodity security in private sector is one question mark that we are actually struggling in the country. But public sector is doing and helping private sector in terms of leveraging commodities flowing from government to private sector in Pakistan. So this is a great development. Then I think, as I mentioned, that we have taken a space at the highest levels of political commitment. President Alvi or the Health Minister, Dr. Faisal Khan, or Dr. Zafar Mirza. We have a special space, and whenever there is a talk about supply chain management, we are invited as a technical partner who will talk about the national commodity security fundamentals actually in terms of evidence that is coming from the LMIS, which is instituted across 152 districts of Pakistan, coming from every facility. So at this level, we talk about planning pool procurement as to how we can work on economies of scale. We're also working on local production, and recently we had multinationals invited, the Minister of Commerce and Trade, Mr. Razak Daud, and Dr. Faisal Khan, who is a special assistant and advisor to the Prime Minister. I feel very honored that they asked me to bridge this meeting with the government, and we invited the local producers and multinational producers, to have exclusive conversation where we invited them to talk about their interest as to which products that they can actually start producing in Pakistan. So this is one thing that we are continuously engaged. President Alvi has become a very good acquaintance, a friend of Chemonics and USAID, where we are invited, and we are given about a 15-minute strategic, space where all chief ministers are there in this federal task force, and I feel very privileged to give a presentation of 10 minutes, and then there's a question and answer session for about 5 minutes on commodity security and local production. So this is what we have done in Pakistan, and I feel very privileged and honored to be part of Chemonics and USAID partner moving this agenda forward. Likewise, as I said, pool procurement, we are working at the structural arrangements where we are talking about how, Azad Jammu Kashmir, Gilgit-Baltistan, and Islamabad regions, which are under the constitutional, obligation of the federal government, can actually demonstrate, at the federal level. And my team members you can see here, we have been able to liquidate, all these, fragmented procurement of these three regional governments as a pool procurement, and that was the first pool procurement under Pakistan's National Procurement Regulatory Authority rules and regulations, and we did this ably for the government of Pakistan. We were only behind the government as people who are providing technical assistance in forecasting, quantification, and costing, and developing bidding documents, procurement documents, and advertising them. And the rest of the government, was actually, and the government was actually on the forefront after this. So this pool procurement has been actually demonstrated, established, and done, completed, executed the last 3 months. And we are trying to have this wise council with the chief ministers and asking them that a concept of centralized tendering in Pakistan and decentralized payment, as we are a 18th Amendment country, just like India, but the provincial governments have their authority to look after their resources, but we are trying to find out a niche and a solution where centralized tendering can be done, so that a central contract can be, and prices can be fixed, and then provincial governments can have their own procurements based on their requirements with a single pricing, and economies of scale can be achieved. This is an important slide, and this one thing, and I'm again thankful to USAID. I interact with my colleagues at global level. Twee, Wayne, Ralph. We have been working on as to how we can learn from each other, south to south, kind of examination of data, and looking at how we can replicate these experiences, from countries which are a little far in terms of demonstrating leadership in terms of bringing the pharma sector from both local and multinational industry, to look at how they can actually exploit the business that we are creating, in addition to the service that we can do to the women of Pakistan. So if you ask me, we are talking about 35 million married women of reproductive age. That is the target of, family planning in Pakistan. Not target from, die-hard perspective. We respect that very much, but from a perspective that what is the market in terms of the, women that require family planning in Pakistan and unwanted pregnancy, that unmet need that we need to fulfill. So this slide, as I mentioned, that, we have been able to bring, the Minister of Commerce and Trade on the table. You will see Dr. Faisal Sultan with the mask on the right extreme lower photograph, and colleagues are sitting there, and then of course from the industry. So this is about $330 million that we have actually worked out with the government of Pakistan, and the government is actually taking this to leverage and entice and create that interest in the multinational industry, OBS and other partners using Pfizer and others, as to how they can actually see this possible avenue to have some long-term agreements with local industry, or they can have some indigenous understanding with the government. I mean, I'm very happy to share with you that Minister of Commerce Razak Daud Sahab was very, very happy, and they are ready to give leverage to the multinational and national pharmaceutical industry partners, like for example buyback guarantees, or levies on import of technology transfer, levies on import of raw material and other things, and these and even giving some land in Pakistan to create that interest and solicitation from the multinational and local pharma industry. So this is the interest, and this is the level that we are creating, where supply chain business has gone from process level to a very strategic level of engaging with the multinational and local pharmaceutical industry, with the Minister of Commerce and Minister of Health, who are looking at the interest of the pharma industry. Again, another question was, how are we doing at the workforce development? And this slide that I'll share with you, that we have been very privileged that Central Warehouse was established by USAID with a $2.5 million. It is state-of-the-art warehouse in Karachi, and this is the ISO certified warehouse. We seconded about 5 or 6 people there for about 3 years actually. But with strategic investment of USAID in collaboration with Diponics and global supply chain, we have weaned off from Central Warehouse Karachi and EPI warehouse in Islamabad. These are the two major warehouses that are repositories of about 70 million people, as 12 to 18 months of storage centers at the national level for the entire country. We have weaned off from there, but my staff, our model is working, with the government, talking and shouldering with them. So my staff is actually sitting with Department of Health and Population Welfare Department across the country. Our strength has been reduced, and we have a strategy of reduction of workforce secondments, and then providing strategic support in very important areas, like I said, this pool procurement and indigenous production from a supply chain perspective. So that's a very different level, and my colleagues are sitting there. I will not talk about more than task order 3, but just to apprise you, we are given the priority of the USAID Pakistan under vaccine preventable infectious diseases and global health and national security agendas. We have, basic health services and MNCA services combined with the basic health services, Afghanistan-Pakistan bordering areas. But ultimately, we are looking at system strengthening from a perspective that how we are graduating Pakistan from family planning to MNCA spikes to, infectious diseases and other, primary and secondary healthcare products. So, staff is there. We have been interacting with universities as well. There are 3 universities who have actually taken up, USAID-funded courses. These are not only in-person 3-credit courses in 3 universities in Peshawar and Lahore, but also online courses that we collaborated with iPlus Solutions and also with UNFPA. We have trained almost 101 people across Khyber Pakhtunkhwa province in all 35 districts in collaboration with UNFPA. So you can see that how USAID investments are leveraging other donors in Pakistan, where not only academia has been engaged and charged with providing sustainable human resource capacity, human resource development, and you know, uh, their development and management, but also working as independent, critical producers of healthcare providers from in-service and out-service, healthcare providers in Pakistan. So you can see, this is a slide, we have been able to partner with academia sustainably. Not only that we have been able to train more than 600 people last year. This year, from UCID side, where Task Force 1 came in, we trained about more than 500 people on, very strategic, product, training of ventilators, across the country, respiratory care, but also, this I+ solutions and, Nutrition International with Canadian money, trained, 101 people. So this is something that I cherish and work, and we all get very amused when we talk as USAID, partners, that how we are able to convert, USAID investments into sustainable development, not only from a public sector perspective, but also the academia, which is taking the charge of training people in Pakistan. Now, there was another question about, how you're doing at LMIS. So, thanks to Rami, Sharmi, all my colleagues there, and Khalisa and colleagues here at UCID Pakistan, of course, my colleagues, UCID, Global Supply Chain, Washington. We have been able to do wonders, actually. And this slide is one slide, but this is a journey of about, 5 years, where you see that not only that we have been able to peg contraceptive logistics management information system in 16,000 health establishments of Pakistan and the private sector with social marketing reporting on this platform, but also that this platform is actually hosted as an inter-ministerial coordination between Ministry of Health and Ministry of IT. So the National Telecommunication Center, which is a semi-government body of Pakistan, actually looks after the data hosting and security solutions, actually. So it's about 9.56 gigabyte data. The system is up 99. You can go to lmis.gov.pk and go to LMI statistics, as a guest, enter as a guest in Washington, and give a password of guest, and you will find this, on LMI statistics data, that you will be very amused as to see that how we have made a public interface of the LMIS, where you can see how many people are, online and who is using this system, just to make sure that, we have the confidence of the system. And again, thanks to Rami, I know, we have been working together for a long time to come far in this level of maturity. I will not go into the details. I'm sure if you will have any questions, but we are taking, contraceptive logistics management information system as a legacy product of USAID, and have taken this to immunization, supply chains, maternal and child health, and now to infectious diseases, actually, and multiple stakeholders are voting in addition to the public sector. This is a slide that I'll just take 2 minutes, and the artificial intelligence that has been injected into the system, thanks to my IT team, led by Jazz and other folks under the leadership of Rami and my colleagues in Washington. We have been able to introduce artificial intelligence within systems. So you can see the procurement module and FAST module, executive dashboards, and there's a demand planning, financial planning, production planning, and supply planning. We are actually trying to hook this data with the industry so that they should know exactly how much Pakistani women are utilizing in terms of the liquidation of the product. That is obvious, from the visibility of data, but also to see what does it mean in terms of average yearly production requirements, for both local and multinational industry. So I would say, we are lacking on the use of data because, we are just trying to bring, industry partners together to use this data. But we have gone far in terms of, now you can see where our understocking, overstocking, and the system itself, gives you populate information and tells you that you pick up these products from these facilities because these are overstocked, and you transport these to understocked facilities, and all this intelligence is actually populated on the system. And thanks to Wayne, we are working with some very important stakeholders, where we have been able to present artificial intelligence at Human and Humanitarian Conference, and our abstract was approved, and we are very happy that we are producing this data for Pakistan. Likewise, I'm sure you know more than myself that FP 2020, Track 2020, multi-donor investment, and LMIS actually provides them the ability that if you go to lmis.gov.pk on LMI statistics, you will find FP 20, Track 20 data, and you will find that in compliance with FP 2020, we have this data populated, and you can see based on their priority that how a cluster of 4 products and 5 products are having any stock situation across the country, which is again artificial intelligence. The data actually automatically tracks. We have injected algorithms into the system, and it automatically does. And likewise, my esteemed colleagues, at the headquarters, we do procurement planning and monitoring report for both public and private sector and social marketing. This is a commodity security, quarterly and annual indicator that we do with colleagues in Washington, and it is being used at different levels. Now, again, you said, what are the requirements in terms of moving forward? So I would say, this is first, and I'm sure tomorrow's newspapers in Pakistan will be actually talking about USAID and Japan's partnership with KP government, as how we have been able to translate national strategic interest of supply chain system strengthening to district level, actually. So these are 6 products and standard operating procedures that we have actually developed for district stores and facilities, where supply chain principles of as I said, how to use MIS, how to use storage distribution, for example, how to use logistics management system, and commodity security. So there are 6 types of posters that we have developed in addition to these service delivery packages from supply chain perspective. I'm sure you know more than myself that service delivery package for primary healthcare and secondary healthcare have been in the offerings for the last 20 years, but there was no development of supply chain packages at the district level. So we have actually developed the first Pakistani package of district level supply chain, standard operating procedures, and with posters, so that easy to see in a poster as to how what I need to do as a store manager, what I need to do as an information manager or LMIS operator, or what do I need to do as a commodity security manager, to look at the metrics and frameworks that we have been able to develop in coordination with the KP government. And this is a great development, and I would say this is something that we need to take forward in Pakistan. These are 3 districts that we have been able to do, and we have been able to train 75 people, but 35 districts in KP and 152 districts in Pakistan is something that we need to take forward. This is another thing, and I'm sure I'm very happy to present this to you. I'm talking about this, at the highest levels with the Cabinet of Pakistan, where the role of the National Institute of Health has been redefined. So, logistics, services, surveillance data, in addition to infectious diseases, is actually will be housed at the data center at the National Institute of Health. And they have been very happy because we have been very much responsive to the COVID-19 technology requirements, as I'm not sure how familiar you are, but at the headquarters level in Washington, but we have been able to develop at least 6 systems, for COVID-19 supply chain. And this is managing about $600 million from World Bank and Asian Development Bank as a procurement and logistics management tool at the national and provincial levels. That is also has taken, and populated the 200 ventilators that this government has kindly donated to Pakistan, on the GIS map actually. So they asked me as to how, Tariq, you and your team can actually help, because the CLMIs has graduated, VLMIs vaccines has graduated to maternal and child health under the auspices of Bill and Gates Melinda Foundation, investments in Sindh and Punjab province that becomes about 65-70% of the country. And they asked me that and I'll be very happy to share with you that notifications from the highest echelons of strategic management of the government of Pakistan have come forward, where they are requesting us that how USAID invested CLMIS should be the foundation of other systems where national health and social health care programs should be integrated into, for example, the national database, regulatory, and then the SAS program, the social protection and health, coverage, data should be intersecting. So we certainly will not go into that kind of detail. But what I'm trying to, share with you is that we have a great opportunity in Pakistan, and the Pakistan example can be replicated in other parts. That how the data from family planning supply chain has graduated to immunization, to maternal and child health, and now it is going to the different other areas of infectious diseases, surveillance, and passenger surveillance, infectious diseases, data, as one platform looking after multiple supply chains in Pakistan. So that is the area that we need to look after in Pakistan. This is my last slide. I'm sorry I've taken more time, but this is my last slide, and this is something that we worked, and I would say this is where we intersect as donors, actually. And I'm very happy to present this to you. USAID is the custodian and the legacy holder, torch holder of this work from CLMIS and family planning and immunization supply chain work in Pakistan. Gates Foundation took this up, and they asked us to develop costed implementation plan as to how we can actually automate the last mile, actually. And of course, as you know, that Pakistan has been able, Chemonics was very privileged to manage two more funds. One was from Gavi Alliance through WHO that we managed upscaling VLMIs across the country. And we got money from Gates Foundation, $2 billion. That project has just closed in August, and we were able to use CLMIS Foundation of USAID to replicate this for a health logistics management information system in the province of Punjab and Sindh. So this costed implementation plan is a document, and I will be very happy to share with you. This actually underscores the importance as to how Pakistan requires technological graduation to be taken forward to automate the last mile, actually. When I say last mile, that means 16,000 basic health units, rural health centers, tehsil headquarters, and district headquarters, where family planning and infectious disease, national health security or global health security, or maternal health services are being offered both by public and private sector. If they can be automated and they can use technology, upgraded technology, and we can train them, this can revolutionize the concept of realizing supply chain management. And this is about $33 million. We are combining this knowledge. This is the knowledge from CLMIS that has created an appetite of about $33 million for the public and private pharma industry in Pakistan, and multinational companies. That is what the appetite we are trying to create, actually. So I'll stop here. But this is a food for thought that how 19 districts in Pakistan have been graduated to be institutionalized with the supply chain sciences and art across 152 districts, where we are getting data from all those 16,000 facilities, and on daily basis we have a transaction reporting onto the system. It's about 15 to 16,000 supply chain logistic transactions that are reported onto the CID funded LMIs. So I'll stop here, and I'll be very happy to answer any questions that you might have. Thank you so much for listening.